Folks, Alfie Vente here once again of Vente Pain Relief Clinic. I'm hoping you're having a good day. Today we're going to talk about 7 pain prevention tips for the TMJ. The TMJ is a temporomandibular joint, your jaw. So if you've watched my videos in the past, you understand that I love working into the jaw. I love treating the jaw. And the reason for that is that I've seen some really significant changes with people. Sometimes what happens is people come in and they don't realize that some of the symptoms such as the headaches, the neck pain, the ringing in the ears, the plugging in the ears may actually be stemming from the jaw. It's not until it's worked on where the changes happen and they realize, wow, there's a link between the jaw and the symptoms that I have. So, as I said, we're going to talk about 7 pain prevention tips for your jaw, the TMJ. The first thing is try to avoid grinding or clenching. And I know that's very hard at times because it's habitual with people. You know, this could be you're grinding your teeth at night, you're clenching at night, but it could also be from stresses. So sometimes what happens is when people are stressed out, they clench their jaws and they don't realize they're clenching their jaws. So there's an important muscle here, this one here. This is just a model of the muscle. It's not quite accurate, but it's a temporalis muscle. It's the one on the side of your head. And you'll see when I clench my teeth, they pop out. And you can feel it when you do this. When that muscle gets really tight, it can give you headaches to the side of the head. So, and that can be stemming from the clenching or the grinding of teeth. So that's one thing to be aware of, to make sure that you're not grinding or clenching your teeth. So again, sometimes what happens is you are not aware of these habitual things that you're doing. Number 2, chewing on one side. So another habitual thing that people do is that they chew on one particular side, whether it's the right side or the left side. And what happens is that if you're chewing on one side, it wears away this side of your teeth. And when that happens, when you open and close particularly when you close your mouth, it becomes uneven. When that becomes uneven, it can cause an impact on the jaw. So that's one thing that that people may be doing and they're not aware of it. That's causing some of the issues. For example, somebody who chews gum on one side. That's something to be aware of. Once you're aware of it, you may want to switch sides in terms of chewing. That's number 2. Number 3, this is a very simple, basic one to understand. Trauma to the jaw. So if you've ever been hit on the jaw, even on the head, this can cause an issue with the jaw. It could sprain ligaments in here. It can cause strains of the muscle spasms from the ligamentous damage. And if you've had an injury to the jaw, you'll understand that it feels like it's not moving normally. It feels like it's somewhat displaced. So that it's not really a pain prevention tip. More so, it's more of a reason why you have issues with the jaw. Now, mind you, linked to that is that if you haven't gotten it checked, you should really get it checked as soon as possible if you have an injury to the jaw. Even if it's a slight hit, maybe you're a boxer or a martial artist and you're hitting the jaw and it's starting to feel a little achy over the next couple of days after the trauma. Get it just double checked just to make sure that the muscles aren't in spasm or there isn't any form of sprain around the area. Number 4, be more aware of the way you breathe. Are you prone to sinus infections, maybe allergies? The reason why I'm saying this is that when you breathe, if you're having a hard time breathing through your nose, you'll end up breathing through your mouth. Oh, I just broke Skelly's jaw here. So when you're breathing through your mouth, what'll happen is you'll actually use your jaw a bit more. Also, you'll be using some of the muscles in the back of the neck. The neck muscles get involved when you're breathing. And when you're constantly using the jaw, it can cause potential dysfunction over time. So that's something to be aware of. A lot of people don't understand and don't realize that potentially their mouth breathing is causing some of the issues with their jaw. Number 5, get assessment for the way you bite. So if you are having problems with your jaw, maybe you're getting headaches, it's probably a good idea to go and get it checked just to assess to see how you bite. Remember I said in number 2, chewing on one side. If you go to a professional, maybe a dentist, they can assess to see how your bite is, if it's even or not. Number 6, improve neck posture. As I mentioned before, your neck is basically, the movement of your neck is related to your jaw. So for example, if you've had a whiplash type of accident, you may find that you start noticing jaw pain. And the reason for that is that, even though I've kind of broken Skelly's jaw here, is that when your head, when you go through a whiplash motion, you know, your head swings back, your jaw kind of swings open like this, and it can cause the jaw to become more, there could be potential damage to the joint itself from that quick motion of the whiplash. So that's just one example. That's more of a traumatic thing, but it could also be that your head's forward. With the neck, there's a couple of things you got to understand with the neck, in that not only is it related to the jaw, it's also related to your shoulder. So if there's an issue with the neck, it can impact the shoulder, and it can also impact your jaw. Finally, number 7, get treatment, especially where possible, intraoral treatment. And I know it's we're going through this pandemic right now, so you know, it might be difficult to get some sort of treatment like that. The next best thing is if you can get like external treatment to the muscles of the jaw. It might help to relax those tissues around the area so that you don't feel as much of the discomfort. Speaking of which, I have an upcoming webinar, and I just want to talk a little bit about this. It's called The Link Between Migraines and TMJ. So if you suffer from both TMJ and migraines, this webinar may give you insight in terms of self-care techniques. For more information, please visit vprc.ca, our self-care technique website for Vente Pain Relief Clinic. If you feel this video may help a friend, family, or colleague, please share. Also, if you can remember, follow, like, and subscribe. Thank you for watching. This is Alfie Vente once again saying, take care and see you the next time. Have a great day.